Welcome back. We've all got to deal with the occasional headache, back pains, or other problems that bring discomfort. But what if that pain just doesn't go away? And what if you've tried everything to no avail? Well, a solution might come in the form of a clinical trial, and one local facility is looking to help you. Susan Angel is here from CNS Healthcare to explain. Thank you for being here, Susan. It's good to see you again. So this is a new one. What is the purpose of this particular clinical trial for chronic pain?
What we're doing is we're looking at a new medication, one that's different than what's out there currently, and we're hoping to demonstrate effectiveness in relieving pain.
Now, if somebody has chronic pain, though, how do they know if this is something for them? And what types of chronic pains are we talking about?
Folks that might be considered for this study would be people who have maybe osteoarthritis, a chronic lower back pain, but otherwise generally healthy. And the first thing that they would need to do would be to come into the clinic for a 30-minute evaluation where we do a thorough medical history, a review of systems, look at medications they're on, and then review the study with them to make sure that they're a good fit.
Is there one in particular, is there something that you guys see a lot of? Like you mentioned lower back. Is there particular ones that you're seeing all the time?
Lower back pain is a big deal. A lot of folks suffer from that, and it impacts them in various ways. And then other than that, the osteoarthritis, maybe some degenerative joint disease, that type of thing.
So even if they've been diagnosed with something like osteoarthritis, this is something that could help in the treatment of that?
Certainly, it sure could. The conditions that we're trying to stay away from are those that are progressive or have a substantial neurological impact.
Okay, so is there anybody that wouldn't be a contender for this type of a treatment?
For instance, in this study in particular, people with fibromyalgia would not be a good candidate. It's more straightforward, lower back pain or osteoarthritis, those types of things. Anything with a neuropathic origin that is particularly radiating, they're staying away from that.
I gotcha. Is there anything that somebody should consider before coming in to see you guys?
Obviously, there's risks and benefits. In some instances, there is the risk of placebo, but in one of our trials in particular, there is no risk of placebo. So we have one study where everyone will get medication. And then you could possibly even stay on some of the medications that you're currently taking too.
Oh, okay. Now, is this particular one for the chronic pain, is it something that, is it a shot, or what can somebody expect when they walk in?
You're coming to the doctor's office. They're just going to check you out. You may get the vital signs. You'll get a physical exam, an EKG, and the medication that you'll take is in pill format. So there's no shots, no IV, no overnight stays required or anything like that. And you definitely don't need health insurance. You don't need a referral. You just simply need to come in and get an assessment completed.
And what do we expect? So I'm walking in for the first time, and let's just say I have the chronic back pain. I come in and it's just like a doctor's office, right?
Correct.
And you sign in, and what are the steps that you take somebody through?
Once they come in, obviously you sign in. You'll meet with a clinical staff member, maybe myself, nurse practitioner, or maybe the physician or another member of the nursing staff. And what they'll do during that time is they'll get a general overview of your chief complaint, what the problem is. And based off of that, they'll go into detail in terms of looking at medications, previous treatments, symptom severity, as well as any potential limitations that you may have participating in the study, and then provide you an overview of the study. And then they'll look at all of that information together, and if it looks like a good situation, then they'll get you signed up for participation.
Oh, great. Now, aside from the obvious compensation that if you're feeling better, you're compensated, do you guys compensate above that monetarily?
What's great about these studies, I mean, yes, you are helping out others, with an altruistic nature, but you're also getting some benefit that way. But as you said, there's also a stipend involved, usually for those who are enrolled in the study for time and travel. So each time you come in, you could have a bit of compensation for that.
Okay, and you guys have other studies besides this one going right now. What are some of the other clinical studies?
We have studies for folks suffering from depression. Folks who have bipolar disorder, they could be depressed or either in a mixed state where they have the rapid shifting of moods. We also have a pediatric ADHD study, as well as a sexual dysfunction studies for those who are on antidepressants.
Oh, great. So pretty much anything. If you're experiencing anything that you're having difficulties and you can't find an answer for it, you can't get over it, then you can come
clinical
see you
trial
guys
may
and
be
see if
the
it's right
answer.
for you.
That's right.
Great. Well, thank you so much for being here and sharing all
Thank
that
you.
info with us, and for all your insights, as well as CNS Healthcare for sponsoring this segment. To find out if their trial is right for you, call 904-281-5757 and make an appointment for a free 30-minute evaluation session. Or you can also log on to their website at cnshealthcare.com.